Oscillopsia. Oscillopsia is the sensation that the surrounding environment is constantly in motion when it is in fact stationary. Oscillopsia is usually a symptom of conditions that affect eye movement or the eye's ability to stabilize images, especially during movement. Causes. Some of the most common conditions that experts have associated with oscillopsia include neurological conditions such as seizures, multiple sclerosis, and superior oblique myokymia, brain or head injuries, especially bilateral vestibulocerebellar injuries. Conditions such as stroke that affect the eye muscles or muscles around the eyes. Conditions that affect or damage the inner ear, including menieres. Conditions that cause brain inflammation, such as tumors or meningitis. Some people are born with conditions that cause oscillopsia, but most people develop it later in life. Symptoms. The American Psychological Association describes oscillopsia as the sensation of perceiving oscillating movements of the environment. Now, according to this definition, most people with oscillopsia experience distorted vision, usually the feeling that the world is continuously moving even when it is stationary. Now, this sensation can cause images to blur, jiggle, jump, or shake. The visual symptoms of oscillopsia can also cause dizziness, nausea, vertigo, or the sensation that the world or room is spinning, trouble moving around, walking, or diving, balance or coordination problems, trouble focusing on subjects, frustration and stress, injury such as from falls or running into objects, and disability either because of injury or due to an inability to be safely mobile. As most cases of oscillopsia arise, at least in part from problems stabilizing images, many people experience it most when they are moving. Symptoms often start during movement and end when movement stops. However, on rare occasions, symptoms can occur while a person is lying or sitting down or standing still. It may also manifest itself in certain body positions depending on the individual. Oscillopsia is often disabling regardless of its frequency or severity because it causes a loss of balance, vision problems, and nausea. People with oscillopsia may be unable to live alone. Furthermore, they might feel frustrated because it is hard to describe the symptoms or explain how significantly it affects their lives. Treatment. Oscillopsia typically develops as a symptom of an underlying condition. Currently, there is no specific or approved way to treat oscillopsia as a condition in itself. The type of treatment, therefore, depends on the underlying cause. Nystagmus is a condition of involuntary eye movement. If the cause of oscillopsia is nystagmus, then the treatment options include special glasses or contact lenses that help clear the vision, which may slow eye movements, especially in congenital cases. Medication or surgery to treat conditions that cause the nystagmus, stopping alcohol or drug use if applicable, and in rare cases, surgery to reposition the muscles that control the eyes to allow for a more comfortable head position that limits eye movement. We have had a comprehensive review of oscillopsia. Vision therapy. Different types of vision therapy may also help treat conditions that cause erratic or uncontrollable eye movements, such as nystagmus. And vision therapy is generally effective in reducing or even resolving oscillopsia. Optometric vision therapy (VT) involves doing progressive exercises under the guidance of an optometrist. These exercises help retain elements of vision and improve visual skills. Medication. Doctors rarely prescribe medication as a treatment for oscillopsia if the cause is a form of nystagmus. A few studies have found that some conditions causing oscillopsia may respond to medications that block types of gamma aminobutyric acid GABA, which is an amino acid that occurs naturally and functions as a chemical messenger in the brain. Examples of these medications include clonazepam and gabapentin. In some cases, anticonvulsant and beta blocker medications may also help treat conditions that cause oscillopsia. an overview of Oscillopsia.